Hello, everyone. Welcome to our presentation on HPV vaccination. My name is Sandy Vang, and I am joined by
Estella Ordinola.
Kimberly Papira.
Mariela Zavala Flores.
So, what is HPV? HPV is a papillomavirus that was discovered by virologist Harald Hansen in 1983, and which started the innovation of vaccines to help fight HPV to prevent cancer. The HPV vaccine helps prevent 6 types of HPV related cancers, such as cervical, vaginal, vulvar, anal, penile, and oral throat. HPV is the most common sexually transmitted infection and can be contracted by skin to skin contact.
Some of the HPV vaccine properties include long-lasting protection, it's non-infectious and highly effective, it creates antibodies, and covers multiple strains. The Centers for Disease Control and Prevention states that the HPV vaccine is a recombinant vaccine, meaning a gene that codes for an antigen is inserted into a harmless carrier organism that then produces the antigen. This makes it safer than traditional vaccines because it doesn't infect patients with the actual virus.
The HPV vaccine has had a tremendously positive impact on society since its introduction. According to Sarkis and Gersoy, many studies have shown a significant decrease in the frequency of HPV infections and related cancers in many countries since the start of HPV vaccination programs. Across the map, the HPV vaccine is included in the National Immunization Program in 100 countries, including the United States. HPV vaccination not only benefits and protects those who receive the vaccine, but they also benefit and protect those in the community that do not receive the vaccine, especially in communities with high vaccination coverage. This phenomenon is commonly known as herd immunity. An increase in HPV vaccination leads to less infections and less risk of spreading the virus. As an indirect result of preventing HPV infections and related cancers, we also see improved public health outcomes by reducing the need for medical interventions in extreme cases such as surgeries, radiation, and chemotherapy. This in turn alleviates strain on healthcare systems and decreases healthcare costs. Overall, the HPV vaccine has proven to benefit not only the individual and their quality of life over time, but their surrounding community and society as well.
As Kim mentioned previously, herd immunity is important for public health. Here we have a diagram showing vaccinated versus non-vaccinated patients. For our Bloom's taxonomy question, we have chosen which type of cancer is directly prevented by the HPV vaccine. The answer choices are A, ovarian cancer, B, pancreatic cancer, C, breast cancer, or D, cervical cancer. The correct answer is D, cervical cancer. Since the HPV vaccine was introduced in the United States in 2006, HPV infections and abnormal cells that can lead to cervical cancer have significantly dropped by 40%. Healthcare providers often perform HPV tests during pap smears, aka pap tests, for HPV, one of the leading causes of cervical cancer. An unclear or abnormal pap smear may be a sign of infection, another problem, or cancer. HPV tests check for certain types of HPV that increase your cervical cancer risk. There are many types of HPV, but not all cause cancer. Prevention of cervical cancer starts with the HPV vaccine and is continuously monitored through a primary care provider. Here, we would like to speak about HPV education for patients and an overall summary of the slides. So a main question we get asked as healthcare providers is, how do you get HPV? The main way to get HPV is skin-to-skin contact through sex and is also known as a sexually transmitted disease and is highly contagious. So how does this pertain to patients? The main way that this pertains to patients is through HPV prevention. Young adults who are having sex are more likely to be exposed to HPV through sexual intercourse. Another important topic to think about is the reproductive health of an individual that is currently having sex. Measures taken to have safe sex should include prevention through HPV vaccine and regular HPV tests. HPV vaccines prevent genital-related infections prior to exposure, including genital warts. The most beneficial part of the HPV vaccine is the cancer prevention. So not only does it prevent cervical cancer, but it can also prevent up to 5 other types of cancer pertaining to not only women, but men as well. These cancers include anal, mouth, throat, vaginal, vulvar, and penile cancer. Here, we have a list of our references to be used by any patient or any person that would like more information regarding HPV and the HPV vaccination.